Good afternoon. We are about to share with you the presentation of our preventive measures for NCOV-19. This is the Interoffice Memorandum of NATCCO, and we shared this to all our employees. Some of it are not no longer, some of the items are no longer effective because of the lockdown, but we hope that this can be a useful material for you and for your offices for the business continuity plan of your cooperative. I will be sharing with you the PowerPoint presentation. And as I share the PowerPoint presentation, I will be discussing the content of each. So this is actually the output of the NATCCO MANCOM last March 11 meeting, and this NATCCO advisory on COVID-19 was presented to the NATCCO Expanded Board NCOV on March 13, 2020. So we have this declaration of commitment, and the contents is as a premise for the guidelines. So it says here, to address the challenges of the global health condition brought about by COVID-19 in keeping with the President's Declaration of State of Public Health Emergency in the country and the March 11, 2020 CDAMC on regulatory relief for cooperatives in view of Proclamation 922, NATCCO is committed to ensure that the cooperative remains viable and disruption to operations are minimized. Of course, the objectives is to minimize health risks to employees, minimize the risk of premises becoming a node of transmission, ensure plans are in place should employees be quarantined or infected, ensure alternative arrangements with suppliers and customers so that business operations can continue. Right now, majority of our employees are working from home, but we have a skeletal force that we call, and they are staying in NATCCO building, in the NATCCO hostel. They are not allowed to go outside, and only for important purchases like food or some supplies for their personal needs. So the basic prevention guidelines are: personal strengthening of immune system is strongly enjoined. So they are advised to eat healthy foods, take vitamins, get enough sleep and exercise, washing of hands, often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 70% alcohol. Always wash hands with soap and water whenever necessary. Do not wear mask if you are well. Wear mask only if you have fever, cough, runny nose, and recovering from illnesses. So you can change or you can add more to it. Do not panic. It's a big call for all your employees not to panic, but they are to avoid crowded places, avoid unnecessary travel. Even our consultants are not allowed to go out of their community anymore. If you are unwell, do not go to work, do not travel, seek medication immediately, provide accurate medical history to your doctors. So if they are going to consult, it's better to tell the doctor if they have some other illnesses so they can be helped accordingly. Avoid contact with people who are sick. Avoid touching mouth, eyes, and nose. This sounds simple, but it's hard to do. Cover your mouth when you cough and sneeze with tissue, then throw in the trash. Face masks should be used by people who show symptoms of COVID-19. Observe social distancing. Okay, for our employees who are staying in NATCCO Network or in hostel, they're not sharing rooms and they're not working on the same place. So they are instructed to keep distance from their office mates. Inside the building, morning devotion will be done through hearing of recorded prayer until after the public health emergency is lifted or withdrawn. So right now, we don't have morning devotions or what you call toolbox meeting, but we pipe in an Oratio Imperata at 9 a.m. and the Divine Mercy Prayer at 3 p.m. for the Catholics. And employees are instructed to clean and disinfect their offices and individual personal spaces. Our admin services group conducts a daily disinfection schedule for frequently touched surfaces inside the office. And alcohol and hand sanitizers are provided by our admin and safety group in strategic locations. In entering the building, we've only opened one gate, the main gate. All employees and officers will undergo thermal scanning. So if they're 37.3 degrees Celsius already, the temperature, then they are instructed not to come in but go home or have a checkup. And for those who have cough and runny nose, they're not allowed to enter the NATCCO premise. Member co-ops are encouraged to convey their concerns through email, messenger, and other digital channels. Should there be a need for meetup, this should be done in a nearby restaurant or hotel. So what we do is, instead of having meetings inside NATCCO building or NATCCO premise, we bring it to other venues. But of course, with the observance of social distance. But since majority of the employees, and because of the lockdown announcements of our president, we are no longer holding meetings, mass meetings, but we are waiting for the lifting or improvement of the situation, lifting of the lockdown and the improvement of the situations. Do transactions with suppliers outside the building. For example, those who would be asking for food deliveries for online purchases, the person should pick it up from the guard area. But the boy or the person who would deliver their products, the products that they ordered, they will not be allowed entry to that co-building. All employees and officers have to disinfect hands using alcohol with 70% solution provided at the guard's desk, and ensure hand sanitizer or alcohol be available to all employees before entering and leaving the office. Inside the buildings, the employees are not allowed to receive visitors. Employees who have shortness of breath, fever, cough, cold, and flu-like symptoms, including diarrhea, will be sent home and will not be allowed to report back until after a 14-day self-quarantine. If really unwell, apply for sick leave, otherwise on work from home status with outputs to be submitted to their immediate heads. So the employees are prohibited to share food and eating utensils. Everyone is required to bring his or her own reusable dining wares. For those who would be working from home, we have adapted the work arrangements where they work from home, especially for those who are vulnerable people, like pregnant women, elderly, diabetics, hypertensive, and those with respiratory illnesses, those who have asthma. For the work from home employees, we also require them to do some 14-day self-quarantine, particularly for those who traveled last few weeks. So for the workforce, the group heads are responsible in identifying their alternate team of employees who can be deployed at different work schedules. So there's no longer, I think, a team B, but those who are assigned as skeletal force. They are asked to stay in NATCCO building. We've provided them the hostel rooms so that they will be comfortable for the duration of their stay in our building. For other staff, the group heads must determine the rotation of work working from home. We're no longer doing this already, but we already have asked all our employees to work from home. But if instead, if you need them to work for your cooperatives or for the operations, then maybe we suggest that you also apply, or we recommend that you practice this working arrangements. So for travel, for our traveling employees, we minimize the travel. We ask them to wear masks in enclosed and crowded areas like lane. Keep sanitizer and or alcohol handy for quick sanitizing. Foreign travel of employees for leisure and vacation is strictly prohibited until the public health emergency is lifted or withdrawn. Daily disinfection protocol of NATCO vehicle is also being implemented, and the hostel is closed to member booking effective March 15 until further notice. So we're using the hostel for our skeletal force, and we don't allow it to be used by non-employees for now until it's being lifted. The lockdown is being lifted. The canteen is not open as well, but we also ask our food handlers to wear masks, disposable gloves, and hairnets. The food handlers are not allowed to receive payments to avoid transfer of virus through money. So there will be servers, and then there will be somebody who's handling the accepting of money. Proper handling of food, utensils, and sanitized storage must always be observed. So if there would be COVID-19 incidences in your cooperatives, or for us in NATCO, we recommend, or we have these guidelines. Upon discovery of employees or officers with COVID-19 symptoms, we immediately lock down the office where he or she is located with other people caught in the area. We inform immediately the local government about the situation and request that the people in the lockdown area be moved out of the building. So we will not be handling it on our own. In instances where PUIs are moved out of the area, the building must immediately be vacated to allow sanitation in coordination with the local government. NATCO, the network, and the community. So these are guidelines for NATCO and for the cooperatives who are our members, and for the community where we are situated right now. NATCO will provide all member cooperatives with COVID-19 related advisories from government line agencies and resource materials. And this is actually one of the resource materials. NATCO shares this advisory as model template for the COVID-19 business continuity plan of all member cooperatives. And NATCO, through the safety officer, will coordinate with the barangay for all COVID-19 related directives and activities. So for our NATCO employees and their families, to ensure that NATCO minimizes the risk of premises becoming a node of transmission, even after the employee has left the office and back for next working day, the employee is mandated to implement the same preventive measures in his or her household. So we suggest that they practice the same to all our employees as they stay and live with their families. These are the members of our BCP COVID-2019 team. Our BCP leader, alternate 1 and 2 member. BCP leader is, of course, our executive officer, CEO, Sylvia O. Paraguya. Alternate 1 is Ms. Evangeline C. Lopez, and alternate 2 is Ms. Haida Kafirma. Members of the BCP COVID-2019 team is Ms. Daisybel Cabal, Ms. Alma Benluan, and Mr. Alejandro Almendran. We suggest that you also have your own BCP team or task force to deal with business continuity plans and procedures. So for the coronavirus hotline, Department of Health, we share these numbers. 65 or should be 8651-7800, local 1149-1150. We hope that this material is useful for you, and we hope that you'll be able to use it as your reference.